Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 233 of the Ask Dr. Angela podcast. So, one of the things that I love about friends, and really good girlfriends, close girlfriends, is that, friends challenge you. They're not afraid to say stuff to you that other folks won't. And so this weekend passed, I think I mentioned that I went to a barbecue over a friend's house, but we went swimming and I was riding around and floating in the pool on a huge inflatable pink flamingo with a cocktail in my hand. At every turn, I had a cocktail in my hand, which was fabulous because I never do that. I feel like I never have really any downtime. So it was nice to just kind of be drifting, drinking, and just not having a care in the world. But my friend really challenged me to go outside of my comfort zone because I'm kind of conservative sometimes in my dress. And my mini-me doesn't like for mommy to go with a two-piece or a bikini because she doesn't want mommy to show off her, boutique abs, body, etc. So I usually wear a one-piece, but my friend gave me a one-piece that had a floral print, it had ruffles, and it was completely off the shoulder. It was cute. It was very 80s. Completely not my taste, but I really liked it. And so if you check out our Instagram, Facebook, Twitter, you'll see a picture of me chilling in this amazing floral throwback bathing suit with a cocktail in hand. But I really liked it. So thank you, CB, for the amazing bathing suit. And whenever I wear it, I'm going to think of you. So I got an interesting question via email the other day. And I love when I get these questions via email. I love when I get the questions anywhere. I don't care what route they come, but this one comes to us from Miss Esther, and this is what she said. Dear Dr. Angela, I've never used a menstrual cup before and am planning to use it. I am also planning on getting an IUD soon. I understand neither a tampon nor menstrual cup increases the IUD expulsion rate. However, do you recommend I wait some time after the IUD is inserted before using the menstrual cup for the first time? Or can I start using the menstrual cup at the same time the IUD is inserted? Well, Miss Esther, why not start using the menstrual cup before you get the IUD? That way you're comfortable with putting it in, taking it out, etc. So, that's kind of my response to your question. Either that, or you certainly could also start using the menstrual cup at the same time that you have your IUD inserted. Now, my question for you is, what kind of IUD are you getting? Are you getting a progesterone releasing IUD like the Kylena, the Mirena, or the Skylar, or are you getting like a Paragard IUD? And the reason that I'm asking is that if you're getting a progesterone releasing IUD, your periods are probably going to be much lighter versus what they would be if you got a Paragard. So just some food for thought. But I would certainly get as much practice as you can inserting the menstrual cup and taking it out. And you'll have to let me know. I would love to know how you like the menstrual cup. I have been quite intrigued. I have quite a few patients, and I am seeing more and more patients going towards more natural forms of handling their periods. And I have a lot of patients that are using the menstrual cups. I personally want to try one, but if I'm going to be completely honest with you, I think I'm a little bit afraid. I don't want to spill it, mess up my fashion, make a mess in the bathroom. I have like a whole slew of concerns, like, oh my gosh, how do I rinse it out? How do I wash it? If I'm in the bathroom, do I have to leave the stall and clean it? My mind just goes on and on and on and on. So, Miss Esther, I would really appreciate if you would give me some feedback on how you're doing with your menstrual cup, but completely go for it. And thank you so much for reaching out. That was an amazing question. So for those of you that have a question that you want featured in the podcast, or you just want to give me a shout out, you know how to reach me. www.askdrangela.com. Click on the question mark and email me a question, or you can direct message me on any of the social media venues, Twitter, Instagram, or Facebook. I would love to hear from you. I love hearing from you. So, in closing, let me leave you with this. And again, this is from my Life's Little Instruction book. In lesson number 376, save an evening a week for just you and your wife. I'm kind of speaking to myself on that one. It's important. It's important to, even if you have kids, to nurture and foster your relationships. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 234 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.